Well, hi everyone, and welcome into Pushing the Limits. This week, I have another wonderful gentleman for you guys to meet. I have Dr. Jason Han with me from Pasadena. Welcome to the show, Jason. It's lovely to have you.
Thank you so much, Lisa. I'm ecstatic to be here.
We connected because I had Dr. Scott Sherr on the show. Well, I've had him on I think 3 times now, and he's one of my heroes in the world of hyperbaric oxygen therapy, among other things, health optimization, medicine, and all of that as well. And you work with Dr. Scott in OneBase Health. Can you tell us a little bit about your work with him? And then actually, before we get into that, can you give us a little bit of your background as well and where you came from and what you studied, etc.?
Absolutely. By trade, I am a physical therapist. Outside of the States, I'm a physiotherapist. Um, I've been a physio for about 15, 16 years now. I specialize primarily in sports rehab. I'm a sports clinical specialist here in the States. Um, Yeah, I've been a physio for a long time. Background as far as before that, I was an elite level athlete. I was on the U.S. national team for Taekwondo
Wow.
about 7 years. So, like a lot of the story is I've been through my share of injuries, and then I not only did I want to help other athletes get better, but two, I wanted to be better at it. I wanted to find another way to make it better. And if you go back into my athletic career, 3 world silver medals is great on
Wow.
paper, but when you live it, kind of sucks. Like, because you're always looking for that edge. So, so
Sounds
I
pretty
took
good to
that,
me.
eh, yeah, on paper, but I think that's what drives a lot of us athletes, right? We're trying to find that edge or trying to get better. And fast forward into my career as a physio and being able to work in pro sports for many, many years and working with a lot of clients here at the office. Um, you kind of see there are limitations as far as like strict physio work, right? If I'm using my hands, I'm using exercise, you're always looking for some type of method or nutrition or modality that could potentially get it even better. Um, so to fast forward a little bit, how I met Dr. Scott, that was approximately 4 years ago. My mother-in-law unfortunately suffered a mild traumatic brain injury. She fell, had brain trauma. She had a brain bleed that was just resulting in neurological type of symptoms. And the traditional medical care just wasn't helping. They were pumping her with steroids, and essentially it was just making her type 1 diabetes worse.
Wow.
Her physical attributes were diminishing, mental clarity, her ability. This was the primary caregiver for our 2 young kids.
Wow.
So to
Yeah.
to kind of see her decline, and that's how me and you really connected too. You were
Yeah.
telling me about your mother's story, and I went to a buddy of mine, a holistic care practitioner, and he suggested I try hyperbaric.
Mhm.
I had very little experience with it. Even in pro sports, I have seen hyperbaric machines. A lot of the athletes in the NFL do have them, but at the time, I'm not really diving into what it is or whatnot. I just was scared. It looks like a little coffin in their room.
Don't say the C
And
word.
sorry. Um, and then fast forward to my mother-in-law. I had a good buddy of mine, Dr. Mark Chang. He is an acupuncturist, Oriental medicine, strength and conditioning coach. And fortunately, I have great people in my life that I'm able to rely on. And he had a mild chamber, or he has a mild chamber at his house.
Mhm.
And I called him up. I said, "Hey, this is what's going on with my mother-in-law. Is it okay if I bring her over?" And me and him are like, he's like a big brother to me. And he said, here are the keys. Make use
Go for it.
use my house. And then the changes I saw in her were tremendous.
Yeah.
And that's how I was introduced to Dr. Scott because the results were so good. It was from HBOT Plus, which is rebranded as OneBase now, and I got to meet or talk with Dr. Scott, and he's like you said, he's like a mentor, he's like a lifesaver when it comes
Yeah.
to these things. And yeah, I've been using hyperbarics for the last 3, 4 years. We now have three chambers here at my facility.
Wow.
I helped bring chambers into the professional soccer team I was with for 6 years. I actually just
Wow.
brought one to another MLS team recently. And since I left pro sports earlier this year, one is to focus on here at my office, and two, to focus on my family now that I have a little bit more time. But three, I'm a go-getter too. So I'm like, okay, let's join OneBase. I already have a relationship with Dr. Scott. Andrew Stead, who is the CEO. We have a really good relationship. So now I'm part of the OneBase team. So
Wow.
that's my long-winded answer right there.
No, no, that's absolutely perfect, and so much to dive into there because, yeah, we did both bond over the fact, yeah, like with my mum's story and your mother-in-law's story, and so you saw, and this is the thing, when you see things firsthand, it's one thing to read about them in a textbook or hear about, someone's ankle got better when they heard it or something, but it's another thing to witness someone who's had a brain injury actually come good again and improve their life. And it really motivates you to go like, what the hell's happening here? Why? How does this work? And I know that you're very curious brained as well, and you're like, well, who else could this help? And could I be using this in my practice? And that's exactly, sort of my journey in a different way. And the reason why I, ended up having, well, I've had two hyperbaric clinics. The first one I had to shut after a couple of years because I was so deep in the weeds with mum. I was like, had 5 companies at the time, and I was like, I've got to open a hyperbaric clinic as well. That didn't work out too well because I was just like juggling like this. And then a couple of years later, I managed to reopen and get into it properly, and now it's going well. But it's such a powerful thing. I wanted people to have what I had, what I'd seen, and it's such a powerful motivator when your loved ones are ones that are affected, right? And then you actually see the difference in it. So with your mother-in-law, what did you see over time? And did it, like a lot of people think, oh, you come in once and you're good, right? No, it's like, no, it takes a little bit more than that. It's not a magic bullet. It's how long before you started to see changes in your mother-in-law, and how much did she get back? If you don't mind sharing her story.
Yeah, absolutely. Um, Maybe if I just go back a little bit, after the initial fall, they had done CT scans and there was um, no bleed was apparent.
Hmm.
She didn't really show any symptoms. Even I've done like I'm in sports, so I do a concussion related test and
Mm.
things are pretty negative. It was more dental damage at that point. She lost about 3 teeth, if you
Well,
think about the impact of that. So she was having more dental type of procedures. About a month and a half after that, she started to develop those neurological symptoms.
exactly.
And
Yeah.
and I remember the fact that my father-in-law, because I don't know exactly what the first symptoms were. I think it was more like vision and memory, like she couldn't see out of her periphery to a certain extent. And my father-in-law took her to the ER. They did a CT and they saw a non-active bleed. It was just there.
Hmm.
Um, so they kept her in the hospital for a few days. They're pumping with a bunch of steroids.
Hmm.
The primary thing at this point is like a headache and some vision, cognitive kind of things. They send her home. She's on a huge dose of steroids. It's really affecting more her type 1 diabetes, and she was just
Yeah.
super lethargic. And then fast forward maybe 3 weeks later, then drop foot, then ability like fine coordination on that one hemi side, and you could tell when she walked, you could tell she wasn't speaking as clearly. So they brought her to the urgent care again or ER, and they were pretty much going to do the same thing.
Yep. It's all I got in their
And
toolbox, basically. Mm.
and if I think a lot of your listeners have maybe not been in this exact situation, or like you have loved ones that it doesn't even have to be brain related or whatnot. But I to be in a situation where this woman was the life of the party, the the one running around with our kids, and to see this
Bang.
change.
Yeah. Yeah.
And you're like, what the F?
Yeah.
Seriously.
Absolutely.
And this is all you're giving us,
Yeah.
steroids. And then
Yep.
the the only other option, if this doesn't work, is you're going to drill into her skull. And but it's a non-active bleed. What is this really going to do?
Yeah.
Um, so I think at wit's end, the family, my wife, and I could see it in my wife's eyes and her voice and her and just all her mannerisms, and even when I said, "Hey, why don't you think of what do you think about hyperbaric?" And she, again, at that point, I wasn't well
Oh,
educated on the fact. She wasn't, obviously. And I go, let's take her to Mark, Dr. Mark Chang. Let's take her to Mark's place. And it took a little bit of budging to her because she didn't know what to trust, who to
no,
trust.
I
Is
know.
this thing going to work? And I think that's a lot of the barrier with any new type of medical care. So at that point in time, my mother-in-law was coming into my clinic for physio. She had a hard time with balance. She had drop foot. Just she had to use a wheeled walker at that point.
Hmm.
We drove her to Mark's house, and I remember I was driving, she was in the passenger seat, my wife was in the back. And I remember her getting into the car. We picked her up at her home, and how fragile she looked,
Yeah.
how difficult it was. And again, it was such a big contrast from who she was.
Yeah. Within
And then
weeks.
yeah, and then we get to the house. It's a pretty long drive, 45 to 60 minutes, and I could tell she was super tired. We walked her in. She needed no one person assist to get in the chamber. It was a sit-up chamber, so at least you have to get down to the ground. And it took a lot of effort to get her in. And at that time, she had essentially like a 10 out of 10 pounding headache that had not diminished in 3 to 4 weeks. And she was just
Oh,
living with it. She was just popping
oh,
Tylenol, like not really
oh,
telling us.
terrible stuff too. Mm.
Yeah. And then she gets in, we do a session. I remember she was just in there. She took a nap. Perfect. You're getting more oxygen that way if you're taking a
Yep.
nap. And then it's really just me, my wife, and Dr. Mark Chang just catching up and just talking. And then when it was time, I believe we did a 60-minute session. She literally stood up outside of that chamber. Again,
Wow. So
it was
quick.
it was a dramatic effect
Wow.
versus what I typically would see here in my
Yeah.
office.
Yeah.
And she literally stepped pretty much non-assisted. Like we put her hand up, but she just got up.
Wow.
And then you could see in her eyes and her face that there was this energy that had not been there. And we were like, how was that? She's like, oh, it's good. And she says, I don't have a headache.
Wow.
So eh, I'm as skeptical as they come.
Yeah.
So I was like, okay, maybe it's because you took a nap or whatever it was, but uh, the headache was gone for maybe 3 to 4 hours. It returned at a baseline of a 7 instead of a 10. So
Mm, brilliant.
me being a
Yeah.
medical practitioner, I'm keeping track of these, and then just watching her walk back to the car, into the car, there was definitely a difference. And I'll say my experience is always going to be different from someone else's, but
Yeah.
that was my initial experience. So right
Amazing.
away, I start to look into stuff.
You start
And
researching now.
yeah, I
Hey,
start
like,
to research, and I look at Scott's um I YouTube Scott, and I'm watching his long presentations, and I told Mark, I said, hey, can you get me in touch with Scott? And then we started to have this conversation, and I believe within a few days I was able to talk to Andrew, the CEO, get a quote. I was like, okay, let me figure out how I'm going to pay for this,
yep.
and but the the results were dramatic for me at least, and for to see my mother-in-law's tr change. Like there's no money in the world that would
Amazing.
that you would pay for something like that.
Mm.
And fortunately, I'm able to. I have a business where I was like, okay, how can I recoup the money and like
Yeah, yeah.
that's all the stuff that's going on. I get it. It's a financial
It's a huge investment.
investment,
Yep. Either at the
and
clinic or if you have it at home. Yeah, it's a big thing. But
exactly. So I get it. But yeah, that was my initial experience with her. And then
wow.
so fast forward, he gave me the keys to his house. My wife was able to take him, I'd say at least 3 to 4 times a week. Um, I believe she had a repeat CT approximately 3 weeks after that, and at
Hmm.
that point in time, the bleed had diminished by 70 to 80%.
Wow, brilliant. Yeah.
And
Mm.
you could see it in the office because she was doing physio here, physio, chiropractic, and stuff like that. So you could see physically she was doing much better,
Wow.
and
That's such
it
a
really made
heartening
us
story.
believers at that point. Yeah.
Yeah. And this is I like this the fact that you still continued with chiro, you continued with physical training, you did the other things, because this is the other part that with hyperbaric, you've got to set the foundation, right? And Scott talks about this a lot too. It's not just about going in the chamber, it's the catalyst for you to be able, like I found it with mum, it gave me enough back that I had something to work with, with physical
Mhm.
training. And as she came back more, I was able to do the next step. And with mum, it wasn't the first time we did the session that she responded. It took 33 sessions before I saw anything. Like what have you seen also in your clinic, with that critical mass of having enough hyperbaric sessions? Have you seen with some of your other clients any sort of results?
Yeah, absolutely. I think Scott points it well. Like the newer the newer the condition or the more the acute the condition, um, you start to see the results a little bit faster. And depending on what the condition is, for more chronic conditions, you're going to need 20, 30, 40 sessions to
Mm-mm.
potentially start to get a result. What we tell most of our clients is, hey, you're not going to feel it one day, 2 days, 3 days, 4 days. Ideally, kind of depending on their case, hopefully we start to get some type of result within 5 to 10 sessions. And then, albeit small, but let's look at these small wins. And like you said, it's a lot of it is education. And like going back to concussions or brain injuries, just knowing you're not just looking for acute symptoms, you're tracking them a long time. And in a sports setting where I was for several years, I see these players every single day.
Mm.
And I remember in 2022, we won the MLS Cup Championship. It's our championship here in the
Hmm.
States. And I remember a particular player, we were away. He had just come back from an initial concussion. He came back to play that game and he was doing fine, but freak accident, while he's sliding to make a tackle, the ball hits him in the face.
Uh,
He continues to he continues to play the entire game. And it was such a like innocuous play. You wouldn't even really notice it
mm,
until we watched the film backwards. So I remember that evening it was a night game at dinner. He comes to me, goes, Jason, can I have some Tylenol?
mhm,
And then I'm saying, why?
mm.
Well, I have a little bit of a headache. Knowing that he just suffered a concussion earlier, well, I automatically call my head athletic trainer over, and then we do a further assessment. And yeah, he basically had 2 concussions within a span of 2, 3 weeks, and we know
Which
that's
is
not great.
no, because that's
So,
much more damaging when you have the second hit. Just for
right.
people listening. Yeah.
So even in that case, I said we need to get him in hyperbarics. This one's going to take a little bit of a while. They've seen it.
Yeah.
And so it's really to educate him. These guys don't want to stay in a chamber for more than 5 minutes, albeit 60 to 90 minutes.
Yeah.
And it was really just, hey, let's just trust the process. And within a few weeks, he was back and he was available for the playoffs and the championship. But it was, yeah, there is a little bit kickback sometimes because we live in a day and age where everyone wants that
Instant.
pill.
Yeah.
They
And
want that instant relief, and Rome wasn't built in a day. We like to say it, but it's truth.
And
And
the brain just does not heal on its own. And a Tylenol is going to do damage to the body and not do anything good. Might take the pain away for a bit, but it is not doing you good. Tylenol, I don't think should ever been improved, but anyway,
Mhm.
then it's certainly not going to get to the healing of the problem. And the brains are such that they really need to be. You need to really focus on the healing of the brain. What often happens with concussion is that your brain sort of rewires itself so you're functional, but you've lost reserve capacity. And
Mm.
this is people like they'll cope, they'll be a little bit impaired, they might have a bit of brain fog or whatever, but they'll cope to a certain level. And you get hit again, that's when it becomes exponential, right? That's why I'm so against players who've been hit in the head, like going back on the field at all. I think keep them off for that game at least, like
Mhm.
any sort of a head knock. And then, Jason, what is if we leave hyperbaric for a second, can we go and talk about your career as in Taekwondo? What did you learn from being an elite level athlete? Like what sort of, because I love interviewing athletes who've done, amazing things and had that sort of focus. How did you take what you learned from being an athlete too over into your daily life, into your practice, and to your academic world and, all of that?
I feel the biggest part of my Taekwondo career was really just discipline. Like especially it being a martial art, that's why I have my kids in it. I don't want my kids to be, it'd be nice if they're really good fighters, but it's more the discipline, the
Yeah.
self-discipline, the respect, and as a martial art, I think that's paramount. Just to just to really build good habits early on.
Mhm.
As I got older, I like to tell this story of it really teaches you to be independent. And whatever happens in your life, there's stepping stones in life. For instance, I told this story not too long ago. When I got into high school, my I'm a freshman in high school, and my all my friends are joining this club. It's like a social club. I have an older sister, and she was in these social clubs before, so my father knows these things well. And I tell him as a freshman, I say, "Hey, Dad, I want to join this thing." He goes, "Okay, let me ask you a question." I'm like, "Yes. Do you want to be like them, or do you want to be like it was a Taekwondo athlete at the time, or you want to be like him?" And I'm like, "Shit." All right,
It
you're
nailed
putting
it.
me you're putting he's putting me in a situation to make a decision, and
Wow.
he'll support me whichever way I go. But I think
Mhm.
I think it's good to be in a martial art or a competitive sport, but it's also important to have good people around you. And unfortunately, my parents were around, and they were very good figureheads for me and to test me in a way to make certain decisions. Um, so like that was in high school, and I turned 16 here in the States. That's when you start to drive. And he even said to me, if I give you a car, are you going to start being lazy? I'm like, no, Dad, just watch. And I would drive to practice. And my dad's still around. He's 85, and he's my biggest supporter. And he was at
Wow.
every training, but I was always there earlier than him. I was there at
I
practice
love
30
it.
to 45 minutes early, and he would show up on time. And like I would leave early because I need to get ready. I need to warm up. And that was just self-discipline. So you fast forward through my career. I was able to do some pretty good things, and when the time came to move on to my professional career, you're always self-doubting.
Mm.
How's it going to be now that I don't have my sport? Is it my identity?
Mm.
And
Mm.
and you're now I'm going to get my doctorate in physio. And the reality is the sport or the martial art aren't your identity. Your identity is everything that got made you successful. So
Amen. Love it.
you take me into school, and I just diverted more of instead of working out and competition, it was more towards the studies. And you get through school, and then you go on to your internships and professional career. And I basically took that. When I graduated with my physiotherapy degree, I did a sports residency. I worked with the Pittsburgh Steelers in the NFL.
Wow.
After that, I worked for Cirque du Soleil as a
Mm,
physio
mm.
for a few
Gosh, that
years,
must
and
have been
then
tough. That's
yeah, but
amazing
it's
athletes.
it's amazing athletes, and I think that you can you can learn something from everyone that you're around. And you have a American football athlete that's running and hitting and it's all like grit. And then you go into performing arts that it's a very solo type of performance. And from a mental mindset, they're amazing because their biggest competition is themselves.
Mm,
And even if you're watching them on stage and it looks amazing to you from like the audience, but once they come off stage, they're like the hardest people on themselves. Like, oh, that one trick was a little bit off, and I'm like, okay. And it's really like you meet different personalities. Okay, I like this. I see how you look at these things and what can work for me. And yeah, it's really taking that mentality through my different sports careers and then opening up a business of that's business is a
yeah,
different story.
isn't it? Isn't it another beast
And
altogether?
and and you soon realize you can't just rely on working out and natural talent or just working hard. You need good people around you, and
Yeah,
it's like having a good coach. And I
yep,
was fortunate to have a good coach that's helped me along the way. And I was able to balance growing a business, and at the same time, I jumped back into pro sports. So
wow,
I was CEO of this business. Now we have 16 employees here,
wow,
and then
amazing.
working for a professional football club. So again, it's people will ask me, how did you do it? It's just discipline
Juggle,
and
juggle,
yeah, and figuring
and
out
have a
what you
couple of
want.
kids in the middle.
Yeah, yep. I got two kids, and but I wouldn't trade it for the world because what it really has done, it's taught me. I've gotten better over time, learning to kind of prioritize what's important to me, and that was a big reason I left the club was to focus on family,
Mhm.
and um, but to even like you said, it's you have this passion because of your brother-in-law and this passion because of your mother, and in a professional sports setting, it's really me taking care of 25 guys,
Yep.
right? And then so you're kind of limited in the outreach. Yes, you
Mm.
can do stuff with other teams and other athletes, but really that the amount of time that takes is extreme.
Yeah.
And here, the last few months that I've been back at the clinic, I've been connecting more with my other physios, my other chiros, and getting to talk to more and more clients that they're treating. And that impact goes actually farther because
Mhm.
I'm teaching my team about hyperbaric. I'm teaching my team on, hey, we'll talk about patient cases. Hey, let's try it this way. Where I'm in this sense, I'm able to impact more people. At
Wow.
the same time, I've taken that over to OneBase and trying to get more hyperbaric chambers into the houses or the clinics here in the States because I there is an impact here. And we're working closely with Dr. Sherr of there's a big education piece that needs to be out there. And me
Huge,
and you have talked
huge.
about that.
Yeah.
And how can we get it into more hands? I think it's beneficial to listen to one, his podcasts are amazing,
Yeah.
listen to all his podcasts and but to structure it in a way that can teach one, the layman that doesn't have a science background to more someone on my science level and then you're on the more advanced side, like being able to talk to all sections of people to educate them in the right way so they can learn what hyperbaric or red light or whatever it is can be beneficial to them.
Yeah.
Then again, you don't have to do hyperbaric. You don't have to do red light or cold plunge or whatever it is. But I think the more education that is out there, there's going to come a place and time in your life or in a loved person's life
Mm,
where that may be an option.
mm,
And if you were never introduced to it in the first place, the amount of time to get to that action spot is well delayed.
mm.
So I
Right.
look at it as my mission to surround myself with amazing people like yourself and Scott and other clinicians to just get the message out there. Like if you ask me hyperbaric questions, I'm 1% of what Scott would say.
Aren't we
But that
all?
one but but that 1% is more than other people.
Exactly.
So that's how I kind of
I love
um
that.
I
Yeah.
step out of his shadows and I can do my own thing.
Yeah, yeah, exactly. No, but it's the same, like none of us are going to be Scott Sherr anytime soon, but we can learn from him, we can relay what we've learned. And as this is what I love about doing this type of thing is that I get to teach as soon as I've learned something, and it teaches me so that I understand it better when I'm teaching. But that's been my university,
Mm,
and that's been my network. They're the people that I've connected to that, I've stayed friends with a lot of them, and that becomes that's powerful and that's valuable. And I think, you sharing your story, there's going to be someone sitting out there in the audience going, crikey, that sounds like, yeah, something that, that I'm experiencing right now, like what your mother-in-law experienced or something like that. And it will click for them because they can relate. So storytelling is really, really powerful too. I think it's really important that we package our life into stories that we can share, because that's where the learnings lie, right? Because we're such story creatures, really. Storytelling
right.
creatures.
I think the science is good, the objective stuff is good. It just doesn't connect with everyone. And I think we're very emotional beings and our emotions are what drive a lot of our decisions. And like you said, if we have some of the objective stuff in the background, it doesn't mean we're going to take action. I do physio, like I have a physio clinic, and just because you have back pain doesn't mean you automatically come in for a visit, because it's at that point in time, it's not worth it to you to come in. The value is not there for you to come in. But in its simplistic form, if it takes away your ability to play golf, and that is your outlet because you go out with your friends, you get out of the house, that is your physical activity, maybe it pushes you.
Mm.
Someone else, at least in our line of business, we're a little bit more proactive. So sometimes that doesn't connect, but for the majority of the population, they wait until it gets really bad.
Yeah, unfortunately.
And so that's why it's like, okay, let's just put it out there. And uh, if you do this, if you do physio, if you do hyperbaric, these are the things that may result if you do it. And and like you said, it's just all we can do is be a sounding board for people and be there for them when they need it.
Mm.
And yeah, just support them as much as we can.
Yeah, no, that's absolutely brilliant. And Jason, tell me a little bit. So you have HealthFit, and you also the what's your official title at OneBase, and just explain to the people what OneBase is, because I want to make people aware of this as well.
So the my practice is HealthFit, physical therapy and chiropractic. I'm the CEO, co-founder with my wife. My wife is a chiropractor.
Hmm.
And yes, physios and chiros get along in certain respects.
I love
Anyways, that's a
both.
different topic. So that's that side. On the side of OneBase, I'm head of development and sales here in North America. And so OneBase itself, it was started with Dr. Scott and Andrew Stead about we're in 2024. I think 2018 is that when they first met.
Hmm.
And Scott can probably tell us a lot better than I can, but essentially he was looking for he's a hyperbaric medicine doctor and he wanted a place that he could refer his clients or whoever wanted a hyperbaric chamber to a company that he would trust. At that time, he didn't trust anyone, so he started this company with Andrew. Fast forward now, I have my experience as a consumer. So using the chambers, I have my personal experience with it. Fast forward now, 3 or 4 years later, uh, I have a good relationship or a great relationship with Andrew and Scott now, but it's really to one, the technology is continuing to improve. I think
Yeah,
there's
for
that.
sure. Mm,
But my vision was, how can we educate more people?
mm,
How can, and it's not just educating people about the science, it's educating the people about the potential results, and not just the physical results, but the life-changing results that come with potential use. Because not anyone with brain fog, whether you had a brain injury or a long COVID or a vaccine injury or
yep.
had too many concussions, there
Mm,
are too many people out there that are okay with it. It is what it is. That's what a lot of people say. It is what it is. When people age, it is what it is.
mm,
But the fact of the matter is that you can do things, whether it's nutritionally, whether it's exercise, whether it's um, whatever modality you choose. There is a better life for you in 99% of the cases, let's
yeah.
say.
Yeah.
So, can we get people to appreciate that as fact? Because it is fact. And you can talk to my staff on how I am. It's like, if you're negative about something, I'm the one that's usually, hey, stop doing that. How do we reverse? How do we change your thinking a little bit? How do we look at it a little bit differently?
Hmm.
Because a lot of it is perception.
Yep.
And if we take a defeated mentality as far as my back is hurt for the last 15 years, it's going to be in pain.
Mm,
I'm like, yeah.
mm,
And you can say, I've tried this before, I've tried that before, and I'm done. I'm going to live with this. Or until you meet someone that could potentially change your life by having you look at it a different manner, or even using professional skill or whatnot to do that, or you have a different modality that could potentially work and that you can use on a regular basis. Just be open to it because there is so much possibility out there that what we're trying to do is put the options out there, but get people to change their mindset a little bit to it can be better. And not only can it be better, you got to put in the work
yeah,
too.
got to put
You
in the
can't be
work, time,
you
effort,
can't be
money.
such a lazy ass at this point in time.
No, no.
And and the beauty of it all is I get to work with a lot of people here at my facility, or I get to meet them through my other practitioners. But since joining OneBase in November of last year, I've had numerous conversations with people on the phone, and you have some people that are had just been introduced, then they read about it. Is it a beneficial thing for them? And then you also have some people that have already started to change their lives as far as, okay, obese. Doctor said they're not going to live very much longer. So they decided to do something, whether they changed their diet, whether they started to exercise. And they had that mental fortitude. They have that discipline to choose a target, come up with a plan, and actually fulfill the plan.
Mm,
So they do that and they start to get positive results. And then those positive results are essentially like a drug because you're like, holy crap, I feel so much better. What
yeah.
else is
What
there out
else?
there?
What else can
Yes,
I do?
exactly.
Yeah.
And then those are the people that I would say if I was going to segment the population that purchases it, it's them.
Mm,
Because there's something about them that knows that there's something better out there. You go like I said in the beginning scope is like, oh, I feel sorry for myself. Can I have something that fixes me? But they're the ones that stop using it after 5 to 10 sessions.
yep.
If we're looking at people
Yep.
from a
A quick fix
decision, yeah, like a
mentality.
decision making standpoint,
Yeah.
and then you have you and me that are kind of like on this side.
Yeah.
That's like
Extreme.
optimizing. Okay, but the reality is there's not much of me and you here. The majority are here.
Yeah.
And actually, the majority are actually in the beginning.
Yeah.
So how can we get the beginning people to see the light? How do we get the middle people to get a better understanding of what this could potentially do to optimize their health. Like, what is exactly do you need? Do you want? Do you see that's going on in your, like, they're a little bit more body aware, I would say.
Hmm.
And okay, let's help optimize you here. The beginning people is just here's some simple education. Here, let's show you stories of potential change. If you want to get there, go at it. If you're going to take the mentality of that's them, I can't do that, I can't help you. You're
No,
going to have to help yourself. Yeah,
no.
you're going to have to
Yeah,
help
yeah.
yourself.
Yeah.
Yeah.
And I find too, like there is the people that I just let go of, if you like, like if they're not willing to put the hard work in, and I can tell pretty quickly now after working with years and trying to drag people to come on, like I've got things that you can do that are going to help you, but you have to hang in there, and then realizing you cannot drag someone along. So when someone comes to me and says, hey, my mother, brother, sister, whatever, she needs your help, and I'm like, yeah, that person needs to they need to seek me out. You cannot pull them along. They have to actually want. So here's some information, here's some education, here's a podcast, here's a thing that you can listen to. If they want to, they need to reach out, unless they got dementia or something like that. Then that's a little bit different. And when I'm taking on a patient who has, say, got dementia or Alzheimer's, I need to make sure I have that support person, and they need to be driving it. I will get nowhere if they don't have a driving person in the driver's seat. You are going to do this, sort
Hmm.
of thing. Or it has to be the actual person that wants to actually make the change. I've got a young man that I've been working with recently who's got repeated brain injuries, and he's just been told, you've got depression, put on one antipsychotic after another. He's been pretty much in bed for 3 years. It's just been terrible. And then when I looked at him and I said, like, recounted his history, his whole thing, like, damn sure you've got a multiple of brain injuries, and we need to get things assessed, and we need to do things, and we need to do hyperbaric, and we need to change the diet, and we need to do this and this. Connected them to some of my fantastic colleagues who are experts in neurochiro and other ones in neurofeedback and so on and so forth. Oh my God, he's a new man. He hasn't got depression. He has a brain injury after brain injury, and structural problems from the accidents that he's had. That's what he's got. And yet for years he's just been put on one drug after another drug and gotten worse and worse and worse. And this is, when you see someone's young man's life and now he's sort of gearing up to maybe about to get back to work, that's life-changing stuff. But he was motivated. He was like, just tell me what to do, I'll do it. Because nobody else has even listened to me. When I came and I said I've got a brain injury, they've just laughed me out the door and told me that I'm depressed. And I'm like, you need to be listened to. You need to be heard, and you have, and you are right. And people, another young mother who had a child recently in the ED, and she knew her child had an epileptic fit. She knew it wasn't a normal one. She'd seen them. She's been looking after for 14 years. She knows what's normal, and gets treated like absolute crap at the ED because what would you know? You're only the mother and another one of these neurotic mothers. I'm like, no, because you sit there with your child 24/7 and you know them inside out and you know every nuance. And these people get often ignored and just given some pill or whatever to make them go away. And that really, really frustrates me, because we need to be properly listening to what the people are going through, and actually trying to get to the root cause of what's happening. And, I think it's super powerful. What you just shared then was just, for me, yeah, that shift in people's mentality. And I think this is where the power of podcasts again come into it, because over a period of time, if I send people off to go and listen to 4 or 5 or 6 episodes of something, and then they maybe go onto other podcasts and they're going, why did nobody tell me about this stuff? It's like they're suddenly like the red pill, blue pill type of scenario in the Matrix, where they suddenly see everything for what it, much, much clearer. And they're
Right.
like, you can't unsee it once you've seen things, you can't.
Yeah.
but you have to take those steps, do the work, and put in the hard yards. And so many people are not willing to go and research, and they don't trust themselves to research because they're not a doctor. You can research. You've got the power. We have the internet nowadays. You have PubMed nowadays. You can work it out. You know, you can work out a heck of a lot of good things. Yes, there's a lot of rubbish out there. You got to choose who you're learning from. But when you get people like Jason, Dr. Scott Sherr, and people like that, then you can work it out pretty quick. You know, who are some good sources to be learning from, and then you can go to PubMed and places like that and start to educate yourself. You know, and then it takes time, it takes effort, it takes money, it takes all of those. I mean, the amount of times that I've run up dead ends and paid a huge amount of money and it didn't work. Yep. So on to the next one. You know, and mum wouldn't be alive. Not again and again and again. She'd have been dead if I had the attitude of, well, as we were told, there is nothing you can do. They were wrong when she had the aneurysm. They were wrong when she had the stroke. They were wrong when she had gastrointestinal bleeding, when she had cancer. She's not dead yet, you know, and I'm just going through the Health and Disabilities Commission at the moment because the last one we were in there with a problem after she broke her hip, and they were like, this doctor wrote in the notes, the family thinks she's going to improve again. I think that's highly unlikely, you know, and a lot of other really, you know, bad mouthing me basically. And I'm like, I've looked after her for 9 years. I've been told 100 million times she's dying. She's not dead yet. And we're not signing your advanced care planning thing where, you know, they do every time we go up there. And to put something like that, she's not going to improve. Did they see her yesterday going out to the gym and heading to lunch with her girlfriend? No. They just saw the sick person that they saw in the hospital, who at that point was very sick. But you don't have to make those judgments that they're never going to recover, because you can be wrong, you know, especially when you've got a fighter family, you know, a family that fights for their loved ones, you know. Anyway,
I think when you asked me about my me being an athlete and how that has driven me, you as an ultra endurance athlete, you know, it takes that discipline, that fight to get through certain moments. You have that. So not everyone needs to be ultimate athletes, but I think we need more and more people with that type of
mentality, you know,
endurance mentality, to when people are telling you, no, that is the status quo, you're going to have to live with this. Nah. Surround yourself or get education, and like you said, the internet's huge nowadays to find people that you could potentially connect with or some information. And when I think about here at my clinic and my office and how people find us, it's when they find us for hyperbaric, a lot of them they've tried everything else, simply put. And then like, okay, I'm dealing with this. What else is there out there? And then there's more and more information coming out about alternative care, even though I don't think it's alternative.
No, I
it should
don't think it's alternative either. I hate the word, actually. It's like the better.
Yeah, exactly.
Provocatively.
Because and nowadays, really, it's just it's more pharmaceuticals, and it's just quick fixes, and it's really just to fill people's pockets. But that's another soapbox. But I think that there's more and more information out there, and then if we continue to help that process along, then we can give people options, and ultimately those options become actual choices for them. And I think it's the realization that you can't help everyone, but you can definitely help more than we have at this point. And I think for someone that's as passionate as you or me, it's also that realization too, that we can't help everyone, but look at the bright side. I was able to help more than I would have otherwise, and to be comfortable in our own skin when it comes to those things.
Absolutely. What a good place to wind up. Dr. Jason Han, you've been absolutely brilliant today. Thank you so much for sharing your insights, your knowledge, for your passion. I love passionate people. Your mother-in-law's lucky to have you, I think, and have found hyperbaric, And I hope she continues to improve, and there's no end point for these things either. People are like, well, how many do I have to do and then I'm fixed? And it's like, well, you're still getting older, you still got other problems, you still maybe have some residual stuff. You might be working on things for a long period of time, and have that in your mind that, just we're all facing aging and all those sorts of things. So we have to keep on it, keep on it. That's what I do. I just keep on it every day. And I know I'm obsessive. I do everything
Just a
to
little
the
bit, yeah.
extreme. Everything to the extreme. But I actually enjoy it too, optimizing and learning and becoming, better than I was before. And I believe, like I'm 55, turn 56 soon, and I'm fitter, stronger, healthier than I was at 25 when I was running ultra marathons.
Mm.
Just exponentially so. The only thing I can't do is run ultra marathons because I don't dedicate the time to it anymore because I've got other priorities. But from a health perspective and everything else, way better, and that's at 30, 50, what am I, 56 years old nearly, um, and I look at my role models are the 70, 80-year-olds that I see that are still competing, or still doing,
Mhm.
or still fit and active. I've got some mates who are in their 70s and they're still doing 100 milers. Now, I'm not going to be doing 100 milers because it's not on my radar anymore. But I'm looking at them and going, damn, there is no excuse for not getting your ass at least to the gym today.
Right. It's perspective, like you said, it's perspective.
Yeah.
Just, yeah.
It's just crazy, and I love that. I think our perception of aging and things are changing as well, and that we've really got to have the number one hack of all hacks for anti-aging isn't a pill, it's exercise.
Mhm.
It's the number one thing that we can all do to slow aging down. Jason, thank you so much for being on the show today. It's an absolute pleasure. We'll put all your links down below if anyone wants to reach out to you. And we'll stay tuned on what OneBase is doing and the education and the hyperbaric, getting those chambers out into the world, which is what we're about to. And I thank you for your insights today. It's been absolutely fabulous.
Thanks so much for having me. I really, like I said, I enjoyed it. It was great. Thank you.